Azad, and this is your host Ayesha, and it is our Mental Health Monday segment with Saihba Ali. How are you, Saihba?
Alhamdulillah, I'm good. How are you, Aisha?
I
And how's
am.
our audience?
That our audience is going to tell us. But thank you for doing this series, Decoding Mental Health, on Radio Azad, only on Radio Azad. And of course, you can find the entire segment on our YouTube channel. So do give us a subscribe over here as well. And Seba Ali, for those of you who may or may not know, she's an LPC, she's an LMFT. She has over a decade of experience in couples therapy, and she's a level 3 trained Gottman therapist as well. And you can follow her Instagram handle at Kame Hearts.
At Saihba Ali, actually, Kami Hearts, yes. Instagram is Kami Hearts, yes.
Okay. And on Facebook?
On Facebook, and if you go to saihbaalitherapy.com on the website, it'll
Mhm.
give you all of the other links.
Okay. And we are going to be joined in a little bit by Dr. Shiza Mohsin. Shiza is no stranger to Radio Azad, and we will be talking to her in just a bit. But today's segment is about understanding marriage and family therapy.
Mhm.
So let's start off a little bit, Seba. If you can explain to us what exactly is an LMFT, licensed marriage family therapist.
Yes. So, a licensed marriage and family therapist is also a mental health professional. We do counseling and therapy like LPC.
Mhm.
The difference is so all of everything that a licensed professional counselor can do and LMFT can do, added on top of that, MFTs are trained in family therapy, meaning when we do therapy, we view individuals as part of a group. We
Okay.
view them in context of their family, in context of their relationships at work with their families, as opposed to just the individual. So
Mm.
we go more in depth. It's basically, because nothing happens in a vacuum.
Yeah.
So we kind of apply a broader perspective. It can broaden to the family, then spouse, children, parents, extended family, friend circle, community, society in general. So it's viewed in context of all of these other relationships, and that's what a marriage and family therapists do differently. And
Mhm.
then we have additional training
Mhm.
and additional, like we take additional courses in couples therapy and in family dynamics and things like that.
Interesting. So, does an LMFT only work with couples?
No, not at all. An LMFT can work as with individuals as well
Mhm.
as couples and family conflict. Again, the even when we are doing individual therapy for anxiety, depression, or any of those things, we are also viewing that individual in context of the family. So, for example, if a person comes to me and they are having issues with anxiety,
Mhm.
I am going to sometimes, if they're okay with it, if the situation is fine, I'm going to ask their permission to maybe meet with, the mother. Like if it's a 21-year-old girl, I'll be like, is it okay if I consult with your mom?
Mhm.
Is it okay if I speak to your sister? So that I get a more of a 360 view. And of course, only if they're comfortable.
Mm.
So then I have more of an idea, more of a holistic view of the issue. And so that's the added on efficiency that we think, like it's just more holistic, it's just more effective to know the whole background. But even if they don't want us to consult or anything, we just ask more questions. We just try to place them in order of their family circumstances. Like, are you the firstborn? Are you the lastborn?
Mhm.
What are the dynamics that are in the family? So all of that does play a role in it, but it is still, we see individuals with mental health issues or families in couples therapies.
Especially, I would think कि हमारे देसी context में
Huh,
family is plays such a big part, right?
absolutely.
So, what if somebody comes to you and they don't want their parents to know, or they
Mhm.
don't want their spouse to know? Does that generally happen?
It can happen, it may not happen, it depends. But as a therapist,
Mhm.
if anybody over the age of 18 comes to me for therapy, by the confidentiality law and the ethical law, I cannot share with parents or anybody else that they're in therapy. So, for example, if a child comes to me and the parent calls me and says, is my child in therapy with you? I cannot even confirm or deny it.
Mhm.
It is only after I get the person to sign a release, an authorization for me to speak to the parents if they want to.
Mhm.
So it's not up to the therapist to consult with the parents if anybody is over 18.
Interesting. So, part of the reason why people don't go for therapy is like a mental, is a stigma.
Of course,
ठीक
yeah.
है. So I have often seen that people don't want to get their kids, let's say, evaluated for a certain disorder, or even for somebody else who's really struggling with anxiety or depression. They don't want to seek help because of that. We'll have to, it'll go on some kind of record.
hmm
Maybe when we apply for a job, we are going to have to admit that we went to therapy. Put that in a little bit of context for us.
So, for first of all, if you are a cash pay client, if you are individually coming to a therapist and paying them cash, nobody else knows that you're in therapy except the therapist. The only exception to confidentiality is if the therapist feels that you could hurt yourself, somebody's suicidal, or you're homicidal, could
Mhm.
hurt somebody else. There's a real imminent danger to somebody else.
Mhm.
Or if there is a child being abused, a special needs person's being abused, or an elderly person's being abused. In those cases, and if the court subpoenas the records, those are the only situations in which a therapist can, you know, kind
Diverge
of
that.
just diverge from the confidentiality. Even in that, it's not like everything is out in the open. It's like selective information can be given in those situations if
Mhm.
necessary.
Mhm.
So that then it's not, there is no risk of any employment records or anywhere else that coming up
Mhm.
because nobody even knows you're in therapy. The only difference is if you are in therapy and you're using your insurance, insurance companies require you to put in certain codes for therapy. Like, what is the person here for? So there's a code for anxiety, there
Mhm.
is a code for depression. So you need to put those codes in for the billing part.
Okay.
But even within that, there are codes like stress, adjustment disorder, life transitions, or conflict, divorce or separation issues. There are certain codes that apply to that.
Mhm.
So it's not necessarily a very, like, grave mental disorder or anything like that. Those
Mhm.
codes are also gentle. And then, like medical records, your employers don't have the right to just ask for your medical records. So they don't have a right to, it doesn't go anywhere except if somebody is requesting the medical records from the insurance agency or something.
I see.
So it's not as simple as it's just part of your public record or anything.
Got it. Okay. Um, so, Seba, can one person's anxiety or depression sometimes be influenced by the family or relationship dynamics?
Absolutely. I mean, we are social beings.
Mhm.
We are part of a community. We are part of a society. We are relationship. We are built of relationships.
Mm.
Every relationship in our life has the ability, or in the past, has the impact to affect us, our thoughts, our minds, in the same way that our physical body gets affected by physical aggressions.
Mhm.
Our emotions and our mind gets affected by the people around us. Like if somebody's suffering through, there's a lot of criticism at home. If there is a lot of somebody's being put down all the time, whether at work or at home, or you're treated like a second class citizen, or you're treated or discriminated against in a society, all of those things have an effect on a person. So
Mhm.
anxiety itself is not just something that comes, maybe there is, it can be medical, it can be on some level, but then it definitely gets affected, impacted, exaggerated, or it shows up because of the other circumstances around you.
Mm.
So absolutely, like our relationships have an impact on how we manage, even if there is anxiety, how you manage it, whether you're able to cope with it, whether you're able to deal with it, anxiety or any other disorder.
Mhm.
It can get aggravated because of the people around us and the way they treat us. So yes, we are relationship beings and relationships affect us.
More than we ever know, I
More than we
think.
are willing to admit sometimes.
Yes, absolutely. So, the first stop for somebody, should they go to a psychiatrist or should they go to an LMFT for anxiety or depression, or how about trauma and grief?
I think, any of these, even when you're speaking to your primary care physician,
Mm.
if you share this information about yourself, that this is what's going on with me, even if you go to a psychiatrist, that's good. Like
Mhm.
going to the psychiatrist, maybe they will prescribe within the mental health community. They'll be like, why don't you also see a therapist? Because psychiatrists mostly prescribe medications and they listen to your issues and they understand it, but it's not the same as weekly 1 hour psychotherapy kind of a thing. So
Mhm.
they will probably guide you to therapy. You can go to the therapist and the therapist will guide you to be like, okay, you can come in for therapy every week, but it'll be great if you could also go and check in with the psychiatrist.
Mhm.
So definitely just go, just seek out some help.
Yeah.
Don't everybody in the field will find a way to help you. The only important thing is make sure the credentials of the person that you're going to are verified.
Mm.
You want to make sure that the person that you're going to is a licensed professional.
Mhm. And where can we check that?
On the state website, you can do online license search for therapists, MFTs. I mean, psychiatrists are mostly,
Physicians, yeah.
physicians and all. But even for therapists and all, you can definitely check on the state website.
Mhm.
And if you do online license search for an LPC or LMFT, a page comes up, and you can search if this person's licensed or not.
Mm. Okay. So, why is relationship health such an important part of mental health?
The thing is, relationships affect us very deep down. Like, and for example, if you have a sprain on your foot, you're going to get some help for it because it's very visible. It affects you directly, and you
Mm.
must get help or you can't move. With feelings and emotions, we are capable of suppressing them
Mm-hmm.
and going on without adhering to without kind of taking care of them.
Okay.
So what happens is, when we do that repetitively, especially with negative feelings or trauma, it develops into complex trauma.
Mm-hmm.
And when it develops into complex trauma, it affects our nervous system. It affects the way we function. So even within relationships or with people, if you have some past trauma of a certain situation in your life, that is going to show up in your relationship with the other person. Or maybe you had been scared. Maybe as a child, somebody had screamed at you
Mm-hmm.
really loudly, and you had been in a very vulnerable position and you had felt very threatened. Well, maybe your spouse just raises their voice a little. And
Mm.
it's not that threatening. You're not a little child anymore. But your reaction is going to be similar to your reaction to that fear.
Mm-hmm.
And that's because that fear has never been dealt with. You've never processed it. And so that is going to affect your relationship, because you're going to bring forth all of that resentment, all of that anger, and being like, why are you screaming at me like that? Like you'll have an overreaction
Mm-hmm.
to a normal argument because there's complex trauma.
I see.
So that's why it's really important to place, and it's not something that you're choosing to do. Your
Mm.
nervous system is identifying a threat, and because we are the reptilian, we are wired to identify danger and
Mm-hmm.
protect ourselves.
Mm-hmm.
You're going to try and protect yourself without realizing that danger is in there.
Okay.
So relationships have a very, very deep impact on us.
Yeah.
And that's what we focus on in marriage and couples therapy. As a LMFT,
Mm-hmm.
a lot of times the focus is on interfamily relationships and things like that.
And especially in a South Asian context, right? So,
Right.
why is something like family systems therapy especially valuable?
Family systems therapy, especially for us, it's valuable because we have a lot of strengths in our communities. We have, as a community, as a culture, we have a lot of strengths of connection, of respect, of being joined, of having a collectivistic culture in
Mm.
which everybody is in it with you. You're never going it alone. There are people around you who support you, who care. If you're hurting, they hurt. All of that, those are our strengths, and that's amazing. The problem is that when we don't put proper boundaries around those, or we are not managing expectations and understanding the dynamics amongst that group, because there's so much that goes into, because there's respect, there are certain things that we automatically think we can or cannot do.
Mm,
Like, if your father is saying something to you, out of respect you don't say anything.
right.
Well, if you don't say anything and you end up going into the wrong profession because arguing with your father was looked down upon, then you hold resentment for your father
Mm-hmm.
and you end up being in the wrong profession. And that resentment eats at your relationship with your parent. So, something beautiful, the connections and the closeness that we have within our culture, turns into something ugly if we don't manage it within the system's perspective, which
Mm-hmm.
means having proper boundaries, which means having setting the right expectations. A lot of our families become enmeshed families,
Mm-hmm.
which basically means that we are like too involved and too like intricately interwoven
Mm-hmm.
into each other's decision making,
Yeah.
or you have to do it this way, otherwise, and not allowing for that. It's better to be interdependent.
Mm-hmm.
It does, we're not looking for independence entirely or be like completely individualistic, but enmeshment means that you cannot make any decisions, or you're not able to live your life or make go a certain way without upsetting somebody or hurting somebody's feelings. And so proper boundaries, proper ways of handling those relationships end up making those relationships stronger.
Wow, so many
So
pictures are
many things
coming.
packed into that, right?
Yeah,
You can
absolutely.
probably think of so many scenarios where that plays out.
Absolutely, absolutely. So, very quickly, Seba, if you can give our listeners a little bit of a flavor as to what happens during a couples therapy session.
Okay. So during a couples therapy session, first of all, like, just to, a lot of times, one of the couple is going to contact the therapist office for
Hmm.
therapy sessions.
Okay.
Um, I would say at this time, mostly it's women,
Hmm.
mostly, especially from the South Asian culture. And I think even across the board, it's
Okay.
mostly women who tend to contact the therapist for a couple session. Um, Different therapists do it differently, but myself, I, as a couples therapist, what I do is I like to see them alone for the first time. I try to see each of them alone, because there is information. I want them to be able to share their perspective without uh, having to be very careful, or kind of hurting, and at the same time without hurting their partner's feelings. Sometimes they can bluntly say things in front of the other partner that they shouldn't really have, because my role is to also teach them communication styles and soft manners of speaking. And in the first session, if they say negative things about each other too loudly, that's not going to help the relationship.
Mm.
So I try to meet with them alone. Also, the other purpose to meeting with the couples alone is to figure out if there is any domestic abuse in the relationship.
Hmm.
Because if there is, and then you see them as a couple, you're aggravating the situation rather than helping it.
Okay.
You could be putting one of the partners in danger. So I meet with them alone. And then after that, they come in as a couple. And, we basically, as a therapist, I would observe their interactions. I would either have them talk about the time they met and how it was, how did you all meet, what happened, or I would even let them talk about a conflict. So that kind of gives me an insight into how do they handle conflict, how do they are they engaging, are they both softening up about the time that they both met. And then after that, it's basically step by step trying to first build some kind of a softness towards each other,
Hmm.
helping them with some communication skills where they express their appreciation for each other, where they kind of relate to each other how important they are.
Hmm.
Then we go on to coming up with issues, what are the problems that we need to solve. And then with different interventions, I help them find, basically, my goal is to help them find a method of speaking to each other, not to bring your problems to me and I'm going to help you solve them. I'm teaching them specific interventions that, okay, when you say, you listen to her or repeat what she's saying, and then you repeat. So basically, I'm giving them the tools
Tools.
to have conversations without getting aggravated or angry, and being able to listen to each other and being able to give each other some validation,
Mhm.
even if not agreement.
Mhm.
So at the end of it, I'm hoping to teach them enough interventions and practice it enough so that they can solve those issues. First of all, have more comfort because they are being more expressive, more nicer to each other,
Mhm.
and then be able to solve the issues by themselves, on their own.
On their
And
own.
if they ever need me, they can always, if something's bigger than they can handle,
Mhm.
they can also come back. So it begins with longer sessions and then tapers off.
Generally, how long does कितने अरसे के लिए ये couples therapy is a good time period of time?
So it is so subjective that I cannot specifically say how long it's going to take for which couple. Like, and this
Mhm.
is so amazing. I'm every day I'm learning something in my sessions. Sometimes a couple would walk in with a lot of problems. And as a therapist, I can be like, oh my God, this is like, how are they going to work through all of it?
Mhm.
And then they'll talk about one problem and that problem solved. And then I'm like, okay, what do we talk about? What do you want to work on next? And they're like, no, no, everything else is perfect between us. And in my head, I'm like, wait, it's not. But then if it's good for them,
Mhm.
then I'm not going to bring up issues unless and
Right.
until it's something that I foresee is going to be a problem in the future.
Mm.
And then sometimes there'll be a couple where to me it seems like everything's perfect, but they have it comes up that they need help with more and more issues. And
Mhm.
so it's very subjective. It depends so much on their attitudes, how long they've been married. But in general, if I were to try and answer that question, I could say that, um, let's suppose I feel like I need 8 sessions to teach them these 8 tools.
Mhm.
So that's what I can go by, that
Okay.
I can teach them these tools in this much time.
Okay, great, wonderful. And this is really, really good information. This is part one of our segment, Understanding Marriage and Family Therapy. And we are going to be joined shortly by Dr. Shiza Mohsin. And we will be talking a little bit about couples therapy in there as well. So stay with us. Lots more